I am speaking with Karin Carroll. She is the Director of Public Health for the City of Gloucester. Hi, Karin.
Hi, Heather. How are you?
Thank you. We are recording this on Tuesday, October 27th. And as I understand it, the citizens of Gloucester received a call last night from the state. Can you describe what the call was all about?
Sure. Whenever a town in Massachusetts goes into the red, which is a map that the state has set up that tracks incidence rates in communities of COVID. So when your incidence goes above a certain rate based on the number of new cases you've had in the last 2 weeks, then there's a couple things that happen. But one of them is that the Department of Public Health and through the governor's office sends out an alert to everyone in that town. It's kind of a reverse 911 type call that just reminds people in that community, your community is now red and you need to really take these extra precautions and really try, to wear a face covering, all the things we know, keep 6 feet apart, stay home if you're sick, to try to reverse the trend in your community. So it's a standard call that goes out to any community when they go into the red, but I think it probably took some people by surprise maybe last night and concerned them that, is there something larger at play that we didn't know about last week? And I just want to reassure people, no, there's not. There's just this, the data takes a little while to, get in and then to change. So I imagine we'll be red again this week. It's based on a calculation of a 2-week period. So until we kind of move through, we'll probably stay red for a couple of weeks, even though our number of new cases has come down significantly in the last week. So, we didn't have any new cases today. We've had a few each day this week so far, but not a ton. And given we did community-wide testing, free and open to lots of people last week, 3 different days, we're again very optimistic that we haven't seen a large number of new cases here in town. So we feel like the little spike we had a couple of weeks ago continues to move in the right direction, people continue to do the right thing, stay home, isolate, quarantine if they're asked to. The testing certainly helped to identify a few more people who were positive in the community and didn't know it. And we seem to be, coming through that outbreak in good shape, and the numbers are declining. We're also seeing that in our wastewater virus level. The numbers have come down in the last week a little bit, and we hope to see that trend continue this week, and that will reinforce the picture that we are kind of moving through that outbreak and we have a lot less activity, COVID activity in town this week.
Let me clarify this. So when we had that initial spike 2 weeks ago, that indicated that we were in the red then, but it's just the state testing, state service that's catching up. Is that right?
Nope. The calculation that turns you red happens every Wednesday, and it calculates 2 weeks back, and it calculates the number of new cases 2 weeks back. So the map is always behind the reality, if you like. Yeah. So we're seeing our number of new cases come down to a very nice low level, and we won't see that in the map for 2 weeks.
Okay.
Yeah.
Great. And what is the level that indicates red? What is the rate?
I believe it's above 8 positive new cases, not probables, but confirmed new cases, an average of 8 per day per 100,000 people. So if that makes sense, it's the last 14 days. We're going to take the average of those 14 days, number of new cases, divide it by our population, multiply it up by 100,000 population. And that is that positivity, that incidence rate per 100,000. So you can be compared to other towns, regardless of size, throughout the state. So ours did spike, in the last few weeks. That number came out well above 8.
Great. So, and the trend you are seeing right now, as of October 27th, is not alarming. Things are moving down, and in 2 weeks we should see this reflected in the state results.
Yeah, hopefully. I mean, provided this trend continues for another week or so, we should move into the yellow in a week or two. Now, what you don't know is what happens, tomorrow. You never know if we have another little outbreak. It could keep us in the red for a few weeks, but again, we're really optimistic based on what we have seen at this point. And also, our number of total active cases for the city has gone from 79 in the kind of height of our outbreak recently, or our uptick, down to 32 today. So that means that many of the people that we found to be positive have finished their course of isolation or quarantining, or have been cleared, for whatever reasons, but mainly it's because they've made it through their quarantine and isolation time. And we haven't had that many new cases coming in. So the total picture of active cases is down to 32, which is great. It's remarkable in the amount, in a short time.
Great.
So,
and
yeah.
are you pleased with the state's response?
Yeah, I mean, we are so fortunate that the state, that the Baker Polito administration so quickly was able to provide us with some testing, some on-site free open testing for the whole community, that we could just encourage people to, come and get tested, and so we can really find out what's going on and get on top of it. So yeah, we're really grateful to the mayor's office for being so quick to request these resources, and not shying away from the problem, and from Mary Lou Sutter's office and the Secretary of Health and Human Services and the governor's office to quickly set those up, with that team from Fallon Ambulance, who has been here 5 days. They've been amazing, and very, very efficiently testing our community, anyone who wanted to be tested. Yeah.
Got tested at this point?
Well, we're waiting for the full data on our last 3 days. The first 2 days, we tested 1,200 people approximately. So that was amazing. That's my cat who wants to say hi. And the last 3 days, I don't know if we continued to do 600 a day. Probably not for the last 3 days, but we know there were a few hundred every day who were at the test sites. They were busy. They maintained a steady kind of flow, but the wait times were less last week. So it implies we probably didn't test quite as many people.
Great. Well,
yeah.
The next big challenge for the city is Halloween. Do you have some suggestions and guidelines for staying safe?
Sure. Halloween's a good one because it's mostly outside, so that's good. And you can wear a mask as part of your costume. So we remind people not to wear a Halloween mask, not to wear a costume mask, but a face covering over your nose and mouth, like we do all the time now. And never to wear a costume mask over a face mask, because you may, that can be dangerous if you're not getting enough oxygen in there. So wear a face covering that matches your outfit, get outside, have fun, stick to small groups, less than 10. No indoor parties, no costume parties inside. I know those are fun, but we're going to pass on those for this year. No pumpkin carving and haunted houses inside. So plan those activities outside with a few friends, that's fine. Trick-or-treating, if people, again, stay in small groups, try to avoid crowded groups around a candy bowl. So we're encouraging people to put small goodie bags out on a table, maybe a little bit away from their door, so children can pick up a goodie bag, and not all be congregating and grabbing into a candy bowl. Those are some of the main points. I know there will be a Halloween event downtown that the mayor's office is running. That should be fun. With our police department, they'll be kind of strolling through that middle area, and again, taking treats at the end so that kids aren't clustering around, a certain shop or anything. So those are kind of the main points. Go to our City of Gloucester website, and there's lots of tips and things about Halloween. I believe the mayor is going to do a call today or tomorrow about Halloween and some of these tips to remind people. I think it's just a good year. As always, parents should keep a close eye on little guys on Halloween, but especially this year, we want to make sure that they're keeping a safe social distance from others, and washing their hands when they get home before they dive into their candy, that kind of thing.
Right, right.
Yeah.
So how about glove wearing? Do you recommend that for little kids? Do you feel like that's important? No.
No, we don't. Gloves kind of give a false sense of security, and small children probably really don't know aren't trained to, not touch their hair or their face or other things. So we actually don't recommend gloves. If it's part of your costume, that's fine, but it's not a barrier to infection control that we want to emphasize, if that's what you mean.
Sure. Yeah.
Yeah.
Well, the last question I have for you is voting is happening right now.
Mhm.
Everyone is taking so many precautions. We have early voting and of course vote by mail, but election day is upon us. Any thoughts about that and staying safe and healthy?
Yeah, I mean, we certainly encourage people to vote by mail if they could, or take advantage of early voting so there aren't maybe as many lines, and be prepared to just be patient, wait, and keep that 6 feet, especially when you go inside the voting polls. When you're indoors, remember that's higher risk than waiting outside. I know our city clerk is doing a tremendous job of getting this set up safely so that we don't have situations inside voting polls. They have enough workers and enough volunteers, and they're doing a great job with it this year. But yeah, I mean, same things. It's as if you're going into the supermarket. You're going to be with other people. You're going to be inside, so face covering. Try to keep that 6 feet from other people. Be patient. Listen to a TED Talk or something while you're waiting. I don't know, but it's important to vote. It's great that we can get out and vote, and that people should be safe if they just follow those usual precautions and wash your hands well when you get home. I know they have plenty of hand sanitizer on the way in and the way out, and those are all good things. Yeah.
Right. Well,
Yeah.
anything else we need to know to stay safe?
No, I mean, we were going to mention what it means to be a red community, and just briefly, I don't want people to worry that we'll have to shut down the city because we're red. The red is just one indicator, and there's not a lot of hard and fast rules. I think if you stay in the red for 3 weeks or more, then we would need to move back a step within phase 3. But again, there's not a huge lot of change that involves. It's a little bit less capacity in our gyms, our libraries, but not a huge capacity decrease. It would require us to reduce outdoor activities, and venues could only have 50 people instead of 100 people. But again, this time of year, we don't have a lot of venues hosting events outside for that kind of those numbers. So, there are things that happen when you're a red community, but most of them are not automatic. And things like schools and sports are taken separately. And again, the red is one indicator the schools can look at and do look at, but they don't necessarily have to do anything when a town becomes red. They don't have to cancel sports automatically. They don't have to change from hybrid to remote or any of that.
So the schools are on basically a separate decision-making schedule? Is that right?
Kind of. Same indicators, and we've done some work with the schools to come up with some indicators and a flow chart of decision-making so people feel clear. But yeah, DESE has its own thresholds of concern points, and when you have when you hit certain thresholds in a school, if you do, then that triggers other things like testing or like some monitoring. But yeah, they have their own, they can make their own decisions within their school committee, watching the full picture of the data. But we have an integrated plan with our Board of Health and our school committee to make those decisions together, and some lists about what data we will use to make those decisions.
Okay, great.
Yeah.
Are there any certain populations that have raised red flags for you? And I mean seniors. Are we worried about our seniors and the senior care facility?
Right. Yes. I mean that they are the highest risk. The seniors still, even though they're getting COVID at lower rates right now statewide, they still have the worst outcomes. They still have the most adverse outcomes. So, interestingly, this fall we have not seen much transmission with our seniors, which is very, very good. It's predominantly affecting younger people. Um, And that's a statewide phenomenon as well. And I think that's to do with schools opening, colleges opening, people staying at work, trying to resume work and be at work. And so it's really affecting younger people who are fortunately not getting as sick. We still don't have a lot of hospitalizations, if any, on Cape Ann right now. Not a lot of 911 calls for COVID, and not a lot of activity in our long-term care facilities, really none. So these are great signs that we'll continue to watch really closely, because that group is at highest risk. So it is interesting how this fall so far has been quite different than the spring in that the age group that's been affected. We want to make sure that just because folks are younger and not getting real sick, that we don't get complacent though, because we can get sick, and we'll have the amount of time and inconvenience. If we get it, we still have to stay home 14 days. We still have to be careful who we are close to and all of those things. So, it's still, and it can still spread then to other members of our community who are more vulnerable, like our seniors. So we want to be very careful heading into the winter, heading into flu season, that we don't let down our guard too much. It's still really important that we do all of these things to protect those seniors who are at higher risk and those with other complex medical histories.
Well, thank you so much. Lots of good information here for all of us. I really appreciate it.
Good. Good to see you, and happy Halloween, Heather. Are you going to dress up this year?
Oh, of course I am. Yeah.
What are you going to be?
Well, I just haven't decided. My costume closet is over there, and I've just sort through it. Yeah.
Good for you. That's great. Enjoy and be safe.
Okay. Bye.
Bye-bye.